So we have a 77-year-old male with end-stage renal disease, status post-renal transplant, hypertension, and type 2 diabetes, who presents with altered mental status and headache for the last 2 days. On exam, he's febrile, somnolent, and has a positive Jolt test. Blood cultures are ordered. Which of the following is the best next step? So your choices are CT brain, lumbar puncture, administer empiric antibiotics and dexamethasone, or administer empiric antibiotics and antifungals. I'm going to give you a few seconds to think about your answer. All right, so the answer is to C, administer empiric antibiotics and dexamethasone. So let's talk about why. So why do we even do head imaging before a lumbar puncture? So the potential complications of a lumbar puncture can range from something as mild as a headache to something as severe as brain herniation, and then the things in between, common things including bleeding and infection. So the actual incidence of post-lumbar puncture herniation is not really known. We do know from some studies that in patients who had other signs of elevated intracranial pressure, like papilledema, who then underwent a lumbar puncture, that about 12% of them had brain herniation. But in all comers who have no evidence of increased ICP, the actual incidence of herniation is not really known. So the IDSA has some guidelines for imaging before lumbar puncture, and this includes patients who are immunocompromised, those who have a history of CNS disease, a seizure within a week, papilledema, abnormal level of consciousness, which is a little bit vague, and focal neurologic deficits. And it's important to know that doing a CT scan has a negative predictive value to detect increased intracranial pressure of about 97%. So it's quite good. So when we do a CT before a lumbar puncture, there's a couple things we need to weigh. On one hand, we're worried about the potential for increased intracranial pressure and the feared complication of brain herniation. But on the other hand, a CT scan can really lead to a delay in diagnosis and thus treatment of meningitis. So another thing that many people have raised as a concern is that many patients are altered, and this can lead to a potential delay in treatment for nearly everybody who comes in with concern for bacterial meningitis. This led to the Swedish guidelines removing altered mental status from their criteria in 2009. And in the UK, they actually defined it a little bit more clearly as focal neurologic deficits and a GCS of 12 or less. And so it's been shown that removing altered mental status from these criteria is actually associated with improved outcomes and earlier treatment of bacterial meningitis. So this is the IDSA treatment guidelines, and this is their framework for deciding how to treat and what the steps are. I'm just going to direct you to the right side of this flow chart. So if they screen positive for one of the things that would make you concerned for increased ICP, you should of course get blood cultures. And then the first step is actually dexamethasone and giving empiric antibiotics first, then doing a CT scan, and then doing a lumbar puncture. So giving early antibiotics before a CT and a lumbar puncture, we're actually quite bad at this. So about 2 out of 3 patients actually undergo a CT scan before LP, and they don't even have an indication, as in one of the IDSA guidelines, to get the CT. About only half of us are good at adhering to the actual guidelines. And we do know that giving antibiotics before doing a CT scan for bacterial meningitis has a clear association with decreased mortality because we treat them sooner. So all this to say that if you have a high clinical suspicion for bacterial meningitis, don't delay antibiotics to get that CT scan. So in summary, imaging before lumbar puncture, remember that you should get blood cultures, then think about whether you need to do a CT scan or not. Consider doing a lumbar puncture and give empiric antibiotics and or steroids. That said, if you think that a CT scan is needed because there is concern for increased intracranial pressure, you should give antibiotics before you do your CT and LP. And again, the IDSA indications for doing imaging before an LP are listed here. And that's it.